If you have prostate problems, there are things you should definitely avoid, my friend. And if you don't pay attention to them, you may have very bad problems in the future. If you are not paying attention to what I am going to tell you now, I want you to pay attention after this video. I have prepared 10 articles about the things you should pay attention to. All of them are very important. Watch the video to the end without getting bored. You will learn very important lessons. First of all, my friend, let's examine what is prostate disease and what are its types, and then let's talk about the things you should pay attention to. What is the prostate and what are its functions? The prostate is a walnut-sized gland in the male reproductive system. It is located just below the bladder, in front of the rectum. The main function of the prostate is to produce the fluid that is part of semen and provides transportation and nourishment for sperm cells. It also helps to expel sperm during ejaculation. Prostatitis, inflammation of the prostate. Prostatitis is inflammation and swelling of the prostate. This can be acute, sudden and severe, or chronic, long-term. Prostatitis can be caused by bacterial infections or non-bacterial inflammation. Acute bacterial prostatitis. This type of prostatitis usually occurs suddenly and is characterized by severe symptoms. Symptoms such as burning during urination, high fever, chills, pain in the lower abdomen and lower back, and difficulty urinating are common. Treatment is usually with antibiotics. Chronic bacterial prostatitis. This type is associated with longer-lasting and recurrent bacterial infections. Symptoms may be milder, but persist for a long time. It is also treated with antibiotics. Chronic pelvic pain syndrome, non-bacterial prostatitis. This type of prostatitis is the most common, and the cause is unknown. It is characterized by symptoms such as pain during urination and discomfort in the groin and genital area. Treatment methods are varied and include painkillers, anti-inflammatory drugs, and physiotherapy. 2. Benign prostatic hyperplasia, BPH. Benign prostatic hyperplasia, BPH, is a non-cancerous enlargement of the prostate and usually becomes common with age. BPH can grow around the urethra, making it difficult for the bladder to empty. Symptoms: weak urine flow, feeling of tightness, frequent urination at night, nocturia, difficulty urinating, feeling that the bladder does not empty completely. Treatment: for mild symptoms, lifestyle changes and regular follow-up are recommended. In advanced cases, medication, alpha blockers, 5-alpha reductase inhibitors, or surgery, transurethral prostate resection, TURP, may be considered. Prostate cancer is the formation of cancerous cells that grow abnormally and uncontrollably in prostate cells. It is one of the most common types of cancer in men worldwide. Symptoms: difficulty urinating, decreased urine flow, blood in urine, blood in semen, erection problems, pain in the groin, lower back or thighs. Risk factors: age, family history of prostate cancer, genetic factors, diet and lifestyle. Treatment: treatment options vary depending on the stage of the cancer and the patient's general health. Methods such as monitoring, surgery, prostatectomy, radiotherapy, hormone therapy, and chemotherapy can be applied. Now let's examine the 10-item roadmap that you should pay attention to if you have prostate problems, my friend. 1. Sitting for a long time. Sitting for a long time is a serious problem not only for prostate disease, but for many diseases. The problem of sitting for a long time for prostate disease is that it can create pressure in the prostate area, and this can adversely affect prostate health. It is important to get up and move periodically, especially for those who work in desk jobs. Here is a detailed examination of these harms. 1. Increased pressure in the pelvic region. Sitting for long periods of time causes constant pressure in the pelvic area. This pressure can act directly on the prostate gland, causing inflammation and discomfort. When the pelvic floor muscles are subjected to this pressure, blood circulation is reduced, leading to poor prostate health. 2. Reduced blood circulation. Long periods of time in a sitting position have a negative effect on blood circulation in the pelvic area. Reduced blood circulation means that the prostate gland cannot be adequately nourished and oxygenated. This prevents nutrients and oxygen from reaching the prostate gland, which are essential for maintaining prostate health. 3. Risk of prostatitis, inflammation of the prostate. Prolonged sitting can increase the risk of prostatitis. A sedentary lifestyle increases the risk of inflammation and infection in the prostate gland. This can cause symptoms such as pain in the prostate, burning, and discomfort when urinating. Fourth, progression of benign prostatic hyperplasia, BPH. Benign prostatic hyperplasia, BPH, is a non-cancerous enlargement of the prostate gland. Sitting for long periods of time can worsen the symptoms of BPH. Symptoms such as weak urine flow, frequent urination, and a feeling of incomplete bladder emptying can become more pronounced with a sedentary lifestyle. 5. Urinary tract infections. Sitting for long periods of time can lead to urinary tract infections. Incomplete bladder emptying can cause urine to accumulate in the bladder and increase the risk of infection. Urinary tract infections can also negatively affect prostate health and increase the risk of prostatitis. 6. Muscle and pelvic floor weakness. Prolonged sitting can lead to weak pelvic floor muscles. The pelvic floor muscles are important for prostate and bladder health. Weakening of these muscles can lead to various health problems, such as urinary incontinence and prostate problems. 7. Risk of prostate cancer. Some research suggests that prolonged sitting may increase the risk of prostate cancer. A sedentary lifestyle can increase the likelihood of developing prostate cancer by increasing risk factors such as obesity and metabolic syndrome. Solution suggestions: regular movement. Get up every hour and take short walks or stretching exercises to avoid sitting for long periods of time. Ergonomic seating arrangements. Use ergonomic chairs and devices to correct the sitting position. Pelvic floor exercises. Doing special exercises such as Kegel exercises to strengthen the pelvic floor muscles. It is important to follow these recommendations to avoid the negative effects of prolonged sitting on prostate health. By adopting a healthy lifestyle, you can protect your prostate health and improve your overall quality of life, my friend. 2. Excessive caffeine consumption. Caffeine can have a stimulating effect on the bladder and prostate. Excessive consumption of coffee, tea, and energy drinks can increase prostate symptoms. Limiting caffeine consumption is important to maintain prostate health. Excessive caffeine consumption can have several negative effects on prostate health. Here is a detailed explanation of these effects. 1. Urinary urge and frequent urination at night. Caffeine stimulates urination by triggering the muscles of the urinary tract. This, together with problems with prostate health, can increase symptoms such as difficulty urinating and frequent urination at night. 2. Urinary tract infections. Excessive caffeine consumption can cause urine to accumulate in the bladder. This can lead to urinary tract infections and have negative effects on prostate health. 3. Prostate inflammation and prostatitis. By increasing the frequency of urination, caffeine can help remove harmful substances that accumulate in the prostate tissue. However, in case of excessive consumption, this advantage may be accompanied by an increased risk of irritation and inflammation of the prostate. 1.4. Progression of benign prostatic hyperplasia, BPH. Excessive caffeine consumption can worsen the symptoms of BPH. Symptoms such as weak urine flow, frequent urination, and a feeling of incomplete bladder emptying may become more pronounced. 5. Effects on general health. Excessive caffeine consumption can also have negative effects on general health. These effects can include urinary tract problems due to the diuretic properties of caffeine and damage to prostate health in general. As a solution, my friend, if your caffeine consumption is high, reduce your caffeine consumption and limit your consumption of caffeine-containing beverages, coffee, chocolate, energy drinks. For healthy alternatives, I suggest you, my friend, choose drinks that do not contain caffeine, such as green tea, coffee alternatives, etc. If you have watched the video so far and found it useful, Do not forget to subscribe. Let's continue. 3. Alcohol use. Alcohol can have irritating effects on the urinary tract and prostate. Especially drinks such as beer can worsen prostate symptoms by increasing the frequency of urination. The negative effects that alcohol use can have on the prostate are as follows, my friend. 1. Difficulty urinating and frequent nocturnal urination. Alcohol promotes urination by triggering the urinary tract muscles. November. This condition, along with problems with prostate health, can increase symptoms such as difficulty urinating and frequent urination at night. 2. Urinary tract infections. Alcohol consumption can cause urine to accumulate in the bladder. This condition can lead to urinary tract infections and have negative effects on prostate health. 3. Inflammation of the prostate and prostatitis. Alcohol is inflammatory in terms of its effects. This means that the inflammation that is already present in the prostate cells worsens even further. This condition further blocks the flow of urine, so that symptoms such as frequency of urination and urgency worsen. 4th, progression of benign prostatic hyperplasia, BPH. Alcohol consumption can worsen the symptoms of BPH. Symptoms such as weakness in the flow of urine, frequent urination, and a feeling of incomplete emptying of the bladder may become more pronounced. 5. Dehydration. When you consume alcohol, 2 inhibits the release of an antidiuretic hormone called vasopressin. This hormone normally helps your kidneys reabsorb water, but its release is blocked, and more water is excreted through urinal. This condition can lead to dehydration and have negative effects on urinary tract health. 6. The bladder muscles are affected by November. We know that when we consume alcohol, it affects our muscles. We feel sluggish, as if our arms and legs can't move properly. November. This also extends to our bladder November muscles. In order for urine to be stored, the muscles in the bladder must relax, and they must contract to expel urine. November. But the presence of alcohol makes it difficult for the muscles in the bladder to relax, so urine-related November symptoms, such as frequent urination, worsen. The advice of experts on this issue, my friend, limit alcohol consumption or stop completely. 4. Overly spicy and processed foods. Spicy and processed foods can negatively affect prostate health. Excessively spicy and processed foods can have negative effects on prostate health. Here is a detailed explanation of these effects. 1. Difficulty urinating and frequent nocturnal urination. Spicy foods stimulate urination by triggering the muscles of the urinary tract. November. This condition, along with problems with prostate health, can increase symptoms such as difficulty urinating and frequent urination at night. 2. Urinary tract infections. Spicy and processed foods can cause urine to accumulate in the bladder. This condition can lead to urinary tract infections and have negative effects on prostate health. 3. Inflammation of the prostate and prostatitis. Spicy foods can help to remove harmful substances that accumulate in the prostate tissue by increasing the frequency of urination. However, in case of excessive consumption, in addition to this advantage, the risk of prostate irritation and inflammation may also increase. 4th, progression of benign prostatic hyperplasia, BPH. Spicy and processed foods can worsen the symptoms of BPH. Symptoms such as weakness in the flow of urine, frequent urination, and a feeling of incomplete emptying of the bladder may become more pronounced. 5. Dehydration. Spicy foods can cause dehydration of the body. This condition can lead to dehydration and have negative effects on urinary tract health. 6. Fatty and processed meats. Fatty and processed meats can have negative effects on prostate health. Especially processed meats can increase the risk of prostate cancer. My friend, experts recommend consuming the following foods instead of fatty and processed meats. Recommended foods to consume for prostate health. 1. Salmon and omega-3 fatty acids. Omega-3 fatty acids reduce inflammation and promote prostate health. Fish such as salmon, sardines, trout are recommended. 2. Tomatoes and tomato products. Tomatoes, which are rich in lycopene, can reduce the risk of prostate cancer. Tomatoes, tomato juice, and sauces can be consumed. 3. Fruits. Fruits such as strawberries, blueberries, raspberries, and blackberries, which are rich in antioxidants, protect prostate health by reducing free radicals. 4. Broccoli and Brussels sprouts. These vegetables, which contain sulforaphane, target cancer cells and support prostate health. 5. Nuts and seeds. Foods, such as walnuts, almonds, flax seeds, and chia seeds, contain healthy fats and proteins, reducing inflammation. 6. Green tea. It contains powerful antioxidants, called catechins, and may reduce the risk of prostate cancer. 7. Olive oil, rich in healthy fats and antioxidants. Olive oil reduces inflammation and has positive effects on overall health. These foods are ideal options for maintaining prostate health and relieving symptoms. You can improve prostate health with a healthy diet. Not drinking enough water. The effects of not drinking enough water on prostate health can be quite serious. Here are some of these effects. 1. Trouble urinating. Insufficient water consumption can lead to difficulty urinating. Tightening of the urinary tract muscles makes it difficult to completely empty urine, which can have negative effects on prostate health. November 2. Urinary tract infections. Not drinking enough water causes urine to accumulate in the bladder, which can lead to urinary tract infections. These infections can have negative effects on prostate health. 3. Inflammation of the prostate and prostatitis. Insufficient water consumption can make it difficult to remove harmful substances that accumulate in prostate tissue. This condition can increase the risk of irritation and inflammation of the prostate. 4th, progression of benign prostatic hyperplasia, BPH. It is known that not drinking enough water can worsen the symptoms of BPH. Symptoms such as weakness in the flow of urine, frequent urination, and a feeling of incomplete emptying of the bladder may become more pronounced. 5. Dehydration. Insufficient water consumption can cause the body to undergo dehydration. Dehydration can have negative effects on urinary tract health. The effect of fatty and processed meats. It is likely that not drinking enough water causes fatty and processed meats to accumulate more in the body. This condition can have negative effects on prostate health. 7. Effects on overall health. Insufficient water consumption can also have negative effects on overall health. The proper functioning of the necessary functions in the body cannot be ensured, which can have negative effects on prostate health. As a solution suggestion, my friend, experts recommend drinking at least 8 glasses of water daily for a healthy lifestyle. Excessive consumption of fatty and red meat can have negative effects on prostate health. Here are some of these effects. 1. Increased risk of prostate cancer. Research shows that excessive consumption of red meat increases the risk of prostate cancer. Red meat is rich in saturated fat and cholesterol, and these factors can promote the development of prostate cancer. 1-2. Prostate enlargement. Saturated fats and red meat can cause prostate enlargement. It can lead to symptoms such as enlarged prostate, difficulty urinating, weakness in urine flow, and frequent urination. 3. Cholesterol level. Red meat and excessively fatty foods can increase blood cholesterol levels. High cholesterol levels can have negative effects on prostate health. Effects on overall health. Excessive consumption of fatty and red meat can also have negative effects on overall health. Such foods can lead to serious health problems such as obesity, diabetes, and heart disease. Solution suggestions. Balanced diet. Consumption of whole grains, vegetables, and fruits, using healthy fats, olive oil, is beneficial for prostate health. Reducing red meat consumption. Instead of red meat, it is important to turn to healthier protein sources. Not exercising. The negative effects of not exercising on prostate health are quite serious. Here is a detailed explanation of these effects. 1. prostate enlargement, and BPH, benign prostatic hyperplasia. Regular exercise can help prevent prostate enlargement, BPH. A sedentary lifestyle can cause the prostate to grow, which leads to symptoms such as difficulty urinating, frequent urination, and a feeling that the bladder does not empty completely. 2. Inflammation and prostatitis. Not exercising can increase the risk of inflammation. A sedentary lifestyle can lead to prostate inflammation, prostatitis. Prostatitis manifests itself with symptoms such as pain when urinating, pain in the lower abdomen and lower back. Regular exercise protects prostate health by reducing inflammation. 3. Decreased oxygen and nutrient circulation. Exercise increases blood circulation in the body and allows more oxygen and nutrients to reach the tissues. Inactivity means that the prostate gland cannot be adequately nourished and oxygenated, slowing down blood circulation. This condition negatively affects the health of the prostate. 4. Weight and obesity. Not exercising can lead to weight gain and obesity. Overweight and obesity are important factors that negatively affect prostate health. Obesity can increase the risk of prostate cancer and BPH. Regular exercise protects prostate health by helping weight control. 5. Effects on overall health. Not exercising also has negative effects on overall health. Inactivity can lead to serious health problems such as heart disease, diabetes, and high blood pressure. These conditions can also negatively affect prostate health indirectly. 6. Emotional and mental health. Not exercising can lead to mental health problems such as depression and anxiety. Physical activity improves mood and reduces stress levels by increasing endorphin levels in the brain. Inactivity can lead to increased stress levels and therefore impaired prostate health. 7. Hormonal balance. Not exercising can lead to hormone imbalances. Regular exercise maintains the hormonal balance in the body and positively contributes to prostate health. Solution suggestions. Exercising regularly. Exercise helps keep the prostate healthy by increasing circulation in the body. It is important to do physical activity regularly, at least 3 to 4 days a week. Activities such as walking, jogging, swimming, cycling can be preferred. Neglecting stress management. The negative effects of not being able to manage stress on prostate health are quite serious. Here are some of these effects. 1. Inflammation and prostatitis. Stress can increase inflammation in the body. This condition can lead to inflammation of the prostate, prostatitis. Prostatitis manifests itself with symptoms such as pain when urinating, pain in the lower abdomen and lower back. 2. Trouble urinating. Stress can cause difficulty urinating. A stressful lifestyle can lead to tightening of the urinary tract muscles and making it difficult to completely empty urine. November 3. Prostate enlargement and BPH, benign prostatic hyperplasia. Stress can cause prostate enlargement, BPH. BPH leads to symptoms such as difficulty urinating, weakness in the flow of urine, and frequent urination. 4. Hormonal balance. Stress can lead to hormone imbalances. Hormone imbalances can have negative effects on prostate health. In particular, a decrease in testosterone levels can have negative effects on prostate health. 5. Effects on overall health. Stress can also have negative effects on overall health. It can lead to serious health problems such as heart disease, diabetes, high blood pressure. These conditions can also have negative effects on prostate health indirectly. Emotional and mental health. Stress can lead to emotional and mental health problems such as depression and anxiety. These conditions can have negative effects on overall health and can also have negative effects on prostate health. My friend, my advice about stress management: to use stress management techniques such as meditation, yoga, deep breathing, and relaxing activities, which are stress management techniques. Smoking. The negative effects of smoking on prostate health are quite serious. Here are some of these effects. 1. Increased risk of prostate cancer. Men who smoke have a higher risk of prostate cancer. Carcinogenic substances in cigarettes can promote the development of cancer by damaging prostate cells too. 2. Increased severity of prostate cancer. Prostate cancer in people who smoke can develop in more aggressive and more challenging forms against treatment. Smoking can lead to faster spread of cancer and more complications. 3. Difficulty urinating and prostate enlargement. Smoking can cause difficulty urinating and prostate enlargement, BPH. This condition can lead to symptoms such as weakness in the flow of urine and frequent urination. 4. Effects on overall health. Smoking can also have negative effects on overall health. It can lead to serious health problems such as heart disease, diabetes, high blood pressure, and these conditions can also have negative effects on prostate health. 5. Emotional and mental health. Smoking can lead to emotional health problems such as stress and anxiety. These conditions can have negative effects on overall health and can also have negative effects on prostate health. My friend, my solution to this issue is my suggestion. Quitting smoking can reduce the risk and severity of prostate cancer. Quitting smoking can also have positive effects on overall health. Neglecting regular checks. This last item is really very important. You should regularly go to a specialist, doctor, for regular checkups. If you neglect your regular checkups, the possible effects are as follows. 1. Benign prostatic hyperplasia, BPH. Benign prostatic enlargement can lead to symptoms such as difficulty urinating, frequent urination, and complete emptying of the bladder. 2. Inflammation of the prostate, prostatitis. Swelling of the prostate as a result of infection or inflammation can cause symptoms such as pain, fever, and difficulty urinating. 3. Prostate cancer. Prostate cancer, if not diagnosed early, can lead to serious health problems result. Regular doctor's checks and prostate examinations are very important to maintain prostate health over the age of 50. Early diagnosis allows for the successful treatment of prostate problems. Paying attention to these 10 substances to protect prostate health can improve the quality of life and minimize prostate problems. Adopting a healthy lifestyle and having regular doctor checkups are one of the most effective ways to protect prostate health. It is important to have annual prostate exams and PSA tests for early diagnosis of prostate cancer and other prostate problems. These tests play a critical role for the detection of problems such as prostate enlargement, inflammation, and cancer at an early stage. My friend, if I summarize what I have told you, factors such as a balanced diet, regular exercise, water consumption, and sexual activity are of great importance for prostate health. A balanced diet, consuming antioxidant-rich foods such as tomatoes, broccoli, and green tea, provides positive effects on prostate health. Regular exercise contributes to prostate health by increasing blood circulation. Water consumption helps to clean the urinary tract and reduces the risk of prostate infection. Regular sexual activity reduces the risk of prostate inflammation by ensuring regular emptying of the prostate. Adopting a healthy lifestyle can make a big difference in terms of prostate health. Your biggest goal here is to adopt a healthy lifestyle mentality and build good habits. It is necessary to build good habits, and you will observe the good effects of applying what I have described from your life in your life. Don't forget to have a good doctor check you regularly, and subscribe to the channel and turn on notifications for more such videos. You don't want to miss such informative videos. I am waiting for your valuable comments and questions in the comments section. Take care of yourself. Bye.